Okay, I'll call the Personnel Committee to order. Privilege as chair. Rich, I think you had a couple things you wanted to briefly talk about before we start. One was about
Yeah. What, you talking about the resolution?
about delinquent.
On the agenda tonight?
No, about the health insurance payments, premiums.
There are two things. Besides the resolution tonight on personnel, one item is retirees. When they discussed retirees tonight on Medicare Advantage, when we had Medicare Advantage back in 2007, 2008, retirees, that's a Medicare Advantage premium. It's a premium-based account.
Excuse me, I didn't want to interrupt you, but it was that policy you gave me that you want to talk about delinquent premiums.
Yeah. Cool. This one and that one. Wait, wait till later.
No, that's fine. Get them on out.
All right, so right now, retirees, we have a self-insured plan for retirees, a PPO plan. And in that, so A and B is primary, Social Security, A and B is primary for them. And the Social Security plan, we take $100 off of their premium because we don't reimburse them $100 as some municipalities do in some cities and the state government. So under Part B, we don't reimburse that, but we take it off the premium. So the premium is $500. We take it off $400. They pay 25% of the $400. When we had the Medicare Advantage, I came to this board in 2006, and the board says, this is a premium-based plan, don't take $100 off. 25% of the premium. So tonight's presentation, you have a choice. They're going to give you a presentation with a premium base. And either deduct $100 or they pay the full premium. That's something you guys have to decide tonight. First, we need to change the plan. The second thing is, we have retirees, some retirees that don't pay the health insurance on time. So I go out, we have a policy. The policy is if you pay late, you owe me $10 late fee. Well, months go by. Some people don't pay for 3 months, 4 months, 5 months. $10 late fee, they pay me the premium, they don't pay the late fee. Or they pay the late fee, they don't pay the premium. So I want from the board is some kind of resolution that maybe if they don't pay in 2 months or 3 months, they're off the plan. I got a person now who hasn't paid in 8 months. But it's person's in a nursing home, it's hard to get the money, I can't talk to her. Do I cut her off and she has no health insurance? So somebody should talk about, maybe not tonight, but future conversation or something.
Okay. So I think we should have a resolution for the next board meeting about premiums and payment schedules. We'll formulate something, put it in front of the committee. All right. The one thing before we do the Medicare Advantage is that we also, Personnel Committee, we received a grievance which has come in front of the Personnel Committee. Next Tuesday night is the board meeting. You want to do this on a special night because we have what, 10 days to?
Yeah, they have 10 days. Well, they already presented it. You have 20 days to respond.
Yeah. So the thing is, you want to do it on a special night, a Wednesday night? Hold the grievance hearing? Yeah.
There's another thing for it. If you're going to do that, maybe you can combine both. Because now you have 10 applicants that applied. You have 8 left. 8 qualified for emergency management director. What are you going to do those people?
Okay. Maybe Rich and I will meet tomorrow, and then we'll try to establish a schedule. Okay? Yeah, Bill.
Chair, can I back up a minute?
Yeah.
Can Rich gather information on what other counties are doing with that late payment? So we have some ideas. I mean, we don't want to be the bearers of bad news, but it would be nice to conform with what's going on around us. Thanks.
I mean, I'm on Cobra, and the deal with me is that you pay within the 30 days of that month, or else you lose your insurance.
Yeah.
That's the way it is.
Huh?
That's the way it is.
That's the way it is.
Meaning a lot of.
Okay. All right. We passed a resolution back in April. I think it was back in April. to look at Medicare Advantage, and then we had a presentation a few months ago. And so now we have representatives from Benetech here to discuss their findings. So Darren, Barry, whoever wants to lead it. And if there's any questions, let's make sure that we get the questions out there tonight.
Thank you.
Good evening. My name is Darren Moser. I'm the Vice President of Finance at Benetech. With me tonight is Barry McNamara, President of Benetech, and Marissa Del Mata, the Account Executive for Montgomery County. Do you want me to come up and stand here?
Anywhere.
Where do you guys want? I'm not sure where.
Wherever you need to lay something out.
Good right there.
Good right here? Okay. All right. We were asked by the county to look at Medicare Advantage plan and what that would mean for the county's retiree population and how it would affect the budget for the county. Okay? So there's several things as I go through tonight that I'll need to explain as we're going through why you look at certain steps along the way. It's not just cut and dry, get a premium rate, and then you're done compared to what you're paying now. There's a lot of other things that come into account, okay? And please stop me anytime along the way if you have a question or you're unclear as to what I'm saying, okay? If you turn to page 1 in your package here, basically what this page is for your entire group, the Montgomery County. What I need to do is I need to start by setting what would be your health insurance budget, including drug, for 2013. Okay? So on the top of the page, you're going to see it says 112 through 612 in the first column. Everybody with me so far? Okay. Now, on the left-hand side, you see medical claims and drug claims. So those are your actual claims that were paid by Empire or Matrix or Cana RX for the time period January through June. So you're a little under 1.6 million for the health medical and 713,000 for the drug. Reinsurance claims, what that is, there wasn't any, but what that is you have stop loss protection, and stop loss protection limits the amount of liability that the county has on a particular individual. Okay, your stop loss level is, I think it's 150, right? Yeah, it's $150,000. So you are responsible, the county itself is responsible for every man, woman, and child for the first $150,000. After that, in a policy here, after that, that amount is called reinsured, and it gets paid through these stop loss carriers. So for instance, if you had somebody who needed a kidney transplant, and that cost $400,000, and that all flowed through during a year, Montgomery County would pay that bill, but then they would get reinsurance for that difference, that $250,000 difference between the $400,000 and the $150,000. Okay? So there wasn't any of those claims for the first 6 months of the year, which is a good thing, you know. Okay. On the next line, so that equals $2,306,000. On the next line, stop loss premium. There is a charge to have that coverage, okay, in order to have that so that you're not responsible for that claims over that amount. And that is set by the stop loss carriers, and that was $104,000 for that time period. You also have this aggregate insurance, which covers the entire group. So you have coverage for a single, but you have coverage for the entire group too. It's another amount that goes into that. Administrative fee was a little under $100,000. That is the amount that was paid to Empire to process the claims, answer the phones, do all the things that they do during that time period. So that amounted to $203,000. If you add together the total claims paid and the fixed cost, your expenses for the first half of this year were $2,510,000 for health and drug. Everybody okay so far? Next column is just 2012, estimating out 2012, because we need to know where 2012 is going to be in order to set 2013. Okay? For 2012, it's not simply just prorating the numbers, multiplying it by 2 in this case, because we do have trends involved, okay? And by trends, I mean, if you go to the doctor today, and that bill's $100, you go 6 months, 8 months from now, that bill's going to be $105, $106, because the doctors are getting an arrangement with the carriers, okay? So that's what I mean by trend there. So the medical claims projection for this year is $3,345,000, and the drug projection is $1,000,000, a little under $500,000. Again, I'm projecting no reinsurance claims because I don't know any at the time that I'm doing the projection. Okay? So the total there is $4,008,000. Again, we have stop loss. The way your plan was written, the stop loss runs July through June. Okay? So the stop loss rate did increase for July 1st of this year. So that's why that number is not exactly double. And the administrative fee that Blue Sheet or Empire charged is also went up a little bit in July. So that's where that number is 202 versus the 99 that you saw before, for a total of 412,000. Yes, ma'am.
On the retirees, those that are Medicare qualified,
Yes.
stop loss cover those as well?
Yes.
Currently?
Yes.
Under Medicaid Advantage, would it still?
No.
Just so I can clear my head. So is that?
Medicare Advantage doesn't have, you just pay a premium, which I'll explain later. So you don't need the stop loss protection. It's included within that.
So the stop loss, I imagine they arrive at that price by the number of
Yes, number of contracts that you have.
contracts that are.
And I'll talk about how that price would change if you pulled the Medicare people out in a little bit.
Thank you.
Okay, no problem. So you add again those two numbers together, you're at $5,256,000, which is the projection for this year. Okay, for 2013, what I do is I look at claims over a period of time, because you can't just look at a 6-month period, because you might have had a large claim, you might have had good claims. So I looked at your claims over the last 18 months. So that takes out the highs and the lows and gives you an average, okay? I then put that on a per contract basis. The number of contracts covered within the county has shrunk since January 2011 to where it is now. You know, some people, you had to get some jobs by attrition last year and that sort of thing. So I use that and then I trend it forward, and that's where that number is of $3,268,000 that you see there. Likewise, on the drug side, I got information from Matrix and Canna RX. The amount projected for next year, $1,551,000. Again, we're not projecting any reinsurance claims. We have nothing that would lead us to know that at this stage. So the total of $4,819,000. Stop loss premium and administrative fee, I've gone over those again. Those fees will remain, the current fees will remain in effect through June of 2013. So I had to get an estimate for the stop loss piece because that rate's going to go up for the next 6 months of, the last 6 months of 2013. And I also got the information from Empire on what their admin fee would be for next year. So that's $427,000. And again, this is based off your current population, which you'll see the membership down below. All right. So the total for next year, $5,247,140. Down below is what you have now, the 2 plan designs: PPO, Preferred Provider Organization, and the EPO. You can see that you have 219 singles, 75 two-person, and so on. The monthly premium equivalent that you are paying is listed next to it: $630, $1,212, $1,605. If you multiply the number of singles times 630 times 12 months, you get that $1,655,000 number, and so on down the road. So the total that you have in premium equivalents right now is $5,519,000. So what that tells us is you have enough money in the pot to cover the expenses for next year. You do not have to raise the rates for the entire pot, okay? So that's the starting point. Just want to make sure everybody understands that. Good? Okay. Now, when we're looking at the Medicare Advantage plan, what we need to do first of all is we need to find out what's out there. These numbers at the top are a little bit different than the other page by a couple people, but that's just a timing issue. So there was 218 singles, 73 two-person, and 42 family. And as you can see, that's with the Medicare people in the PPO. If you take the number of singles, of those singles, 145 of them are Medicare contracts. Okay, people over 65 that have Medicare. Of the two-person contracts, you have 8 that are one person's over 65 and the spouse is under 65. Okay, so in that case, right now it's a two-person contract. If you look at a Medicare Advantage plan, you'd have one person in a Medicare Advantage plan and one person still in the regular plan. That's how that would work. Okay, so in that case, you'd have 2 contracts where you only have 1 contract right now. And then 29 of those 2 people are both over 65 or Medicare. Okay, so when you add up all those, the 145 to 8, and then 29 and 29, you get 211 Medicare contracts that you have. Okay, and then over on the right, it just shows once you take those contracts out, how many you would have left in the core group with the current plan design. Did the same thing on the EPO page. EPO, there's only 16 contracts that are Medicare. The lion's share of everybody is in the PPO plan. So you have a total of 227 right now that would be Medicare Advantage eligible. Okay? The next page, basically, if you went to the Medicare Advantage plan and you're going to have a smaller group within the county pool, right? That's in the self-funded plan, okay? So Empire is going to raise the cost of their administrative fee and the stop loss. Bill, you were asking a little bit earlier, okay? Because on the stop loss side, let's just talk about that quickly for a minute there. I'll skip the admin for a second. But on the stop loss, most of these Medicare people, well, all of them, they're covered first by Medicare and secondary by your plan. So they're not going to hit stop loss, those people. The people that potentially would hit stop loss are the actives or the early retirees under Medicare where your plan is primary. So what they did is Empire said, okay, if you write a Medicare Advantage plan with us, okay, we could do a Medicare Advantage plan without them, you know, with another carrier, and we did look at the other carriers too. But Empire was the most competitive as far as the rate that came back. So this is if Empire is the carrier for the Medicare Advantage. If they're not the carrier for the Medicare Advantage, then this number goes higher than what I have on this page. But I had to put a stick in the mud, make sure that everybody understands that. So getting back to the admin. Less people, they raise the admin, okay? The difference in the admin is going to be $5.98 more than what you're paying right now per month, per contract, for the first 6 months of the plan. And there would be 309 contracts left, okay? Instead of like 496, which you currently have. That gives you that 11,000 numbers. Then for the second half of the year, the amount goes up a little bit higher. It's $6.19, 309 contracts, 11,000. So total admin would go up 22,000. Same thing on the stop loss, but stop loss is done single and family policies. They give you a rate for single and a rate for family. Now they really hit you on the stop loss because you're taking away a big portion of their group that they know isn't going to hit stop loss. They raised the stop loss, if you go to a Medicare Advantage, they raised it by 25% for January 1st, okay? And that's what that $4.32 is for a single and the $11.72 for a family. Again, you multiply that out by the 6 months, it's about $16,000. I had to estimate the second half of the year because they can't do stop loss until they get closer because they want to know if there's any large claims in the pipeline. So I threw on another 15%, which is basically what we see from year to year. Yes, Tom?
I have to leave, so I want to ask this question. I know you're probably not there yet. I'm not real confused, but how do you break out the, like right now we have this matrix with a can of RX.
Yes.
How does that work if they're doing that?
If the members go to a Medicare Advantage plan, is that what you're asking?
Well, like right now, we're with
Matrix and
Can RX, which
Right.
is the same, whatever you want to call it. Because I just keep seeing the thing, drug claim.
Right.
How does that break out from, if we're in contract with them,
Yeah.
how does that work? I'm confused on how.
You would still have a contract with them. The members in the Medicare Advantage plan would no longer be utilizing their services. The other county, the actives and early retirees would still be using Canna RX.
How many is that?
309 contracts.
That would no longer be using that?
No. That would still be using it. The number that would be not using it because you're splitting it into Medicare contracts is like 227 contracts.
That wouldn't be using it?
Correct.
That you would be handling, or the
Empire.
Medicare Advantage would be, they would be under Medicare Advantage.
Correct.
But there would still be 309 under
309 contracts, yes.
under the matrix.
Correct.
So you're saying stop paying claims under Matrix and Empire.
Yeah,
And just pay premium now for, so they're paying to leave Matrix and Empire, and now you're just paying straight premium.
You still have the contract with them. In your contract, you don't guarantee how many contracts are going to be with Matrix and Canna RX. Canna RX is a voluntary program, by the way. You know, so a member can decide to use it or not use it. So you still have those contracts. You're just, you know, if you, let's say you bought another county and you put them in there, put them in your coverage too, you know, that number would go up. You know, you're not guaranteeing or held to a number of contracts by the PBMs, the pharmacy benefits. Does that answer?
It does. No, you answered my question. I'm just.
You're pondering some more. Okay.
So, to elaborate on Tom's question, those seniors that are at Medicare Advantage qualified, they would be getting their prescriptions through the Medicare?
Through the Medicare Advantage
Or
plan.
whatever it is?
Through a Medicare Advantage plan, the card. Okay? We're going to talk later. Right
They
now.
would not have a choice.
Correct.
They couldn't go to Canna RX even though it may be cheaper.
It would cost the county more.
It costs
the county.
You don't want them doing that because you're paying a premium to Empire or whoever the carrier would be. It would just be additional costs on top of that. Okay?
And Empire wouldn't reduce the Medicare Advantage rate on the possibility that some people might use Canada. It might influence the renewal next year. Going in, they're going to assume that everybody who's self-insured in the Medicare Advantage plan is going to use the Medicare Advantage drug. So you'd have to pay that premium. And as Darren said, if people were still allowed to go to Canada, you'd be paying the full premium for the Medicare Advantage plus the cost of the claims to Canada with the raise your costs.
Okay, Bill?
And then down below is just the aggregate, which again was that coverage for everybody. So basically, if this is something to consider as we're going through the numbers, but if you went to the Medicare Advantage plan, the cost, the administrative and stop loss cost would go up $53,000 on the rest of the people that are left. Okay? Just so that everybody understands that. Okay. Now, on page 4, this shows what the claims were for your Medicare population. Okay? For the Empire piece, we looked at the period 8/11 through 7/12. You had $319,000 in claims. You also had to pay Empire administrative and stop loss charges there. So the total health cost was $466,000. Okay? The matrix in CanRx is for the 7/11 through 6/12 time period was $818,000 for your Medicare population. So you can see that drug costs, because Medicare's prime on the health side, you got the same population. It's a lot less on the health side than it is on the drug side. Okay? What I did here is I backed out the rebates on the Medicare population and the retiree drug subsidy that the county would lose by going to a Medicare Advantage plan. You would no longer get those back. So I reduced that $818,000 by that amount to get to $728,000. Okay? If you add those two numbers together, the 466 and the 728, you're a little under $1.2 million. Okay, everybody good so far? And then what I did was I just came up with a per member per month, that's what that PMPM is, $445 roughly for each Medicare contract. Okay? Now, the next page, what that does is that the first column is what I showed you on the first page. Just brought over, okay? That's the full group. Now, if we take out, if we just have, we take the Medicare people out, okay? The medical claims only go down a little over $350,000 because, as we saw before, they don't account for that much of the claims. The drug claims go down a sizable amount. You can see they go down over $850,000. So the column, the second column that says projected with no Medicare would just be the actives and the people that are early retirees left. The stop loss and the admin fee, while they're less than what they were on the first column there, they do include that $53,000, okay? So you can see I've added in the $53,000 there. So the total cost for the actives and early retirees for you guys would be $3,937,000. I did the premium equivalents again down there. Right now, these people are bringing in $3,899,000. So if you went with the Medicare Advantage plan, the suggestion would be to raise the rates about 1% for the rest of the people that are left. Okay. Everybody good so far? Okay. Now, the next page, page 6, shows, okay, let's see what the rates would be and how for the Medicare Advantage people. We know what it's going to be for the actives and the early retirees. Let's see what it is for them. And I put on here 2 different sets of numbers, and Marissa will go over the plan designs in a little while with you, but I just wanted to throw the numbers out first. Empire Blue Cross came back with a premium rate for 2013 with a $25 office visit plan, which is similar to what the current membership has now. The drug card is a 10, 20, 40, which again is similar right now. You've switched to 0 on generic over the last year or 2, but you used to be at a 10, 20, 40 here at the county. That monthly rate is $262.68, okay? That's for health and drug. If I take the estimated number of contracts at 227 and annualize it, it becomes $715,000, okay? We also looked at a plan that has a $0 office visit. So that plan would, you know, in essence, on the health side, make the member maybe a little even better benefit than what they have now. They have 0 when they go to the office visit. That rate's $297.38. Annualized, it's $810,000. Okay? Now, on the next...
Darren, but what's the drug under that one? Same?
Same.
Yes.
Same.
Yes. Okay. Now, the next page is basically the same as you just saw 2 pages ago. And if you look down to total expense, we were at $3,937,000 in the second column. What I did was I threw in that 227 contracts with the $25 office visit plan at $715,000. If you go down to the bottom below that, you will see now if you had a Medicare Advantage plan at the $25 office visit plan and the actives and early retirees, the cost would be $4,653,000 compared to if everybody stays in the current plan, you'd be looking at a cost of $5,247,000. Okay, so that savings is $593,000. It's just the difference between the 5,247 and the 4,655. Everybody good so far? Okay. And then again, I took out those rebates for the Medicare population. You'll still get rebates on your actives and early retirees as they utilize the plan, but since there's a lot less, and then the Medicare G subsidy, so you're still looking at a projected savings of $503,000. Okay.
And a rate increase on the actives and the early retirees is less than 1%.
1%, yeah, that 1%. Okay. Now, this is what Rich was talking about a little bit earlier. On the last page, let's look at how this affects the Medicare people. All right. Currently, they have a PPO and an EPO, and their current rate for an employee is $91 a month, and that's with that $100 credit that Rich was talking about earlier. They take the rate, subtract 100, and then take 25%, and that's $91 for an employee, $182 for a spouse. Same type of logic for the EPO. Okay. With the $25 advanced office visit plan, in the first scenario, what I did was I said, if you're given the $100 credit now, let's see what it looks like if you get the $100 credit going forward, okay? That, then the member's rate monthly charge would be $40.75. So if you go over to the right, you see that a retiree would save, an employee would save $50.25 a month, okay? And spouses would save $81, or their rate would be $81.49. They'd save $100 a month based on the way the formula is. I also threw it in, let's say you decide to go with the 0 office visit, you know, because you don't want members to have too much out of pocket. Again, the rate would be $49.35 with the $100 credit and $98.69 for spouses with the $100 credit. And you can see what the retirees' monthly savings would be to them out of what they're paying to the county right now. Okay? And then down below, I did it, let's say you decide you don't want to give them a credit. Okay? You don't want to give them that $100 credit. They still need to have Medicare B though, okay? So they still have to keep that and pay that fee themselves each month. So you see the rates go up because you're not giving them the credit, but you see that there's still a pretty good savings for the retiree as well as the county if you went to a Medicare Advantage plan, one of these 2 Medicare Advantage plans, okay? Yes?
I got a question.
Sure.
If we didn't give back the credit, then how much is our savings?
Well, let's see. It'd probably be 70, because it's 25%, right? The rate. So really, you're giving back like $75, right? Times 227 contracts times 12 months. So that I think I have my calculator somewhere. I think it'd be like $75 roughly times 227 times 12 if you didn't give them that savings.
Okay, that would add to the $500,000 savings, correct?
Yeah, but some of that $500,000 savings is the member's savings here. Okay.
200,000. Comes out to another 200,000. No, I'm just saying, we could, that's another $200,000 that we could save. And they're saving money and we're saving money.
Yes.
Okay,
Yeah.
that's all I wanted.
Okay. Does everybody kind of understand? First, I laid out where you got to be for 13. Here's the total cost. Here's what the cost would be for those non-Medicare if you decide to go that route, with the additional charges that Empire would put on top of it and the stop-loss carrier. And even with those charges, when you add the Medicare Advantage in, where there is potential savings on the table. Okay? Yes, sir.
So I want to be clear what he said. So our savings at the end of the last sheet was $503,000.
That is for the county and the member. Okay, that's not just county.
That's counting the end.
Yes.
But if we don't give back the $100,
Right.
that 503 goes up,
Well,
about 170,000.
in that case, you would, yeah, that's outside of the formula, because right now you're reducing their rate, so
I guess what I'm trying to get
yeah,
straight.
the retiree would pay more than if they get the credit, and that savings would go back to the county.
So
I'd have to calculate just to make sure.
they would save money,
And you would save money.
and we would save 670,000,
Uh,
650, roughly. Okay.
Maybe not that high, but yeah, something. You guys would,
6.25.
you guys would save you both would, this has potential to save both sides. I guess that's
It's a win-win.
what the presentation is
So I
showing.
have one more question on it. Everything's based on stop loss and us still being self-insured.
Yeah.
With the number of people going down, did you do an analysis that if we just not become self-insured and just bought straight coverage? Because I don't know how many of those are single, how many are double, how many are family plans.
I did not do an analysis of that, but I can tell you right now, when you look at those charts, you see claims, administration, and stop loss. If you guys are taking the risk right now, okay? Which means you pay the claims no matter what the claims come out to be. Yes, you have the stop loss and all of that. If you go to like a fully insured type product, then the carrier, whoever that may be, Empire, Blue Shield, CPHP, whoever, would be taking the risk. And in that case, they're going to throw on an additional charge for taking the risk. So that would cost you more.
But we wouldn't have the higher admin fees.
You wouldn't have the higher admin fee by moving the people out to a Medicare Advantage plan. Your admin fee doesn't go up if it goes up whatever the little amount that they raise it incrementally each year if you keep everybody in the plan with Empire. That 53,000 was just to show you if you pull them out with Empire. Okay. Does that make sense? Okay.
But you gave the premium equivalents anyways, in the charts.
Yeah.
So the thing was that if we wanted to do a comparison, the numbers are there, because they gave you the premium equivalents. So, and the numbers of contracts that are involved. So we could do the multiplication fairly quickly, you know what I mean? And know if you can save money or not save money. But you gotta get rich.
Just to underscore what Darren said, for the non-Medicare population, you move back to an insured product. You're transferring the risk back to the insurance company. Their administrative charges are not going to be any lower than they are right now. In addition, since they've taken back the risk, they're going to charge a fee buried in the premium rate for the assumption of that risk. So their administrative costs would be the same, if not higher. In addition, there'd be a factor 4 to 6%, 8% that would be their fudge to protect themselves against the assumption of all of this.
So they're gonna take that stop loss fee that we're paying now and bury it someplace else.
Yeah, and they're gonna tweak it up
Okay. All right.
to protect, because again, right now you have the risk up to $150,000 on an individual claim. The only risk you're ceding to somebody else right now is the stop loss. But if you went back to an insured product, Empire takes all the risk, they're gonna charge you for it, but it'll be buried in the fully insured rate.
That's one of the active employees.
Yes, yes. But to answer the question about what if you took the actives and non-Medicare back to an insured product, the premium rates would be higher than the self-funded.
But not
premium.
necessarily would leave. I mean, without analysis, we don't really know if we're paying more for self-insured or, less than being self-insured.
No, you're paying less being self-funded.
Right now,
Yeah.
Yes.
guaranteed.
That's the cheapest way to go.
Yeah.
Okay, I got Rich first and then,
Well, that's what I explained before. Marissa explains the benefit package. I want to explain why she's saying the benefit package. If I can do that.
yeah.
But Mike, so,
I was gonna ask you.
Do you guys have any more numbers questions for me?
Don't go away.
No, I'm gonna sit, if that's okay.
so on page 6, Darren has 2 plans. There's a $25 copay and a 0 copay plan. Marissa's going to explain to you 2 plans tonight, $25 plan and a 0 copay. And the reason why is, they're correct when they say that it's the same plan as we have in the county. But the active employees have this plan. Retirees have this plan, but the problem with retirees is Social Security A and B, which they have, pays 80%. Blue Cross pays the other 20%. So basically, they have a 0 copay plan. They can pay from 0 to $25 on the copay to the doctor's office. Sometimes they pay $1.10, $1.15, but basically it's almost 0. So to look at this, I suggested to look at the 0 copay plan, which is more in line with what retirees are getting right now. So if you look at that, Darren has put in $810,063. So if we go to page 7, you see on page 7, Darren has in $715 and $540 in red. If you add in $810.63 in that spot, and you go down and add up the difference in the savings, it comes out to $409,249. Because you're increasing the premium for a 0 copay. So it's not $503, it's $409, $249 for a copay 0 plan. And the other situation is, even though they have a 0, and I'm not advocating for retirees, I'm just trying to tell you both sides here. So let's say you go to this $25 copay plan. So the retirees go to the doctor's office, and if you just see a list of all the $25 copays that right now the retirees don't pay. And besides that, right now the retirees, all generics are free for retirees. Generic drugs. PNRX, Rayban dog, a 3-month supply for a 90-day supply is also free for the retiree. So now when you go to 10, 20, and 40, all generics are $10, all Rayban drugs are $20. So of course, who uses the most drugs? Retirees. So the question you have to ask yourself down the road is, you can have a savings in this plan for Blue Cross because it's a experience-based plan for them. You're going to save some money. But on the other side of it, what are retirees going to save? Even though you have a savings in there, and if you look at page... Oh, it could. I'm not sure. Because again, it's going back to that 100 hours again. What page was it? The last. The $100 or no $100. So if you take the $100 away, for example, and they're saving 25 hours, the retiree saves 25 hours for a month, and they go and buy 3 or 4 drugs, he's coming out, he'll pay more than 25 hours. So the question is, what do you want the retiree to do? Have no co-pays, and no drug costs, or save the county some money and let them pay for it. So basically, Marissa's going to tell you, the $25 copay and a zero copay plan for,
And we don't have a zero copay
plan with it.
plan.
But it's basically zero.
Yeah, basically. Yeah.
Just that, the difference, I just did a quick calculation because it's the other way around. On that, if you keep the $100 credit for the county, it's about $70,000 a year.
In additional savings.
Yes, to the county.
Marissa, before you start, I got one question. You said the 593 was total savings. How much of that is county savings and how much of that is the employee savings? Because you had a number once before.
Yeah, I'd have to go back because I did a couple scenarios. I'd have to go back. I would say basically that it would be probably at least $350 to the county and $150 to the members.
That's on the 593,
503.
503.
Yeah.
What would it be for the 409?
Same ratio.
Same kind of ratio?
Same type of ratio.
So on the 593, we're looking at 350 county savings.
The 503.
503.
503. Roughly.
503.
Oh, the 503, yeah.
Okay. Yeah, roughly like 350. And that's including giving the $100 credit like you would now.
Okay.
Any questions on the numbers?
Nope.
So what I did was, I went through this with a fine tooth comb. I took the current benefits that they have with the Empire PPO, and I compared it to the Medicare Advantage plan. And actually, Rich, you did a really good job summing up the major changes. If you go through here, really, there's about 3 big differences. Everything else is exactly the same. We asked Empire to match it as best we could. Again, because this is not a self-insured product, this is a filed product in the New York State Insurance Department. You can't necessarily pick and choose what benefits you want. They file these products with the New York State Insurance Department, and the benefits are the benefits. So they match as close as they possibly could. The first major change is currently right now, if a PPO member goes to a non-participating Blue Shield provider, they're responsible for deductible coinsurance. With the Medicare Advantage plan, that actually goes away. They quoted what they call a passive plan design. And as long as these members go to a provider that accepts Medicare nationwide, they actually just pay what the in-network copay would be. So $25 for office visit, things of that nature. One of the other big changes was the diabetic supplies and equipment and education. Currently, right now, with Empire, the active plan, that